Good afternoon. Welcome, everybody. It's not easy to talk after lunch, but we will try to keep it light so that it's not a problem to digest what we're going to present to you today. So my name is Silvia Vignetti. I'm a senior researcher at CSIL. We have seen this morning, we have talked about the big picture, about the open science and its global significance. Now let's shift from the vision to application. We will explore in particular how to monitor impact and how assess the value of open science practices. So this session will introduce two key tools developed by the PathOS project. One that can help monitor impact and the other one that can help assess the value of open science practices. So the session is organized in this way. First, we will hear about the Open Science Impact Indicators Handbook, which is a sort of a catalog that structures the academic, economic, and societal impacts into a coherent set of indicators. Then we will dive into a cost-benefit analysis framework that can help us translate this impact into strategic insight for policymaking and decision-making. Then we will close with a real-world case study that applies the cost-benefit analysis framework to specific cases. And then we will follow by a discussion with you, the audience here and online, and with two case study representatives to reflect on the challenges and the potential of the use of these tools. So we are eager to hear your voice about the applicability, the potential relevance for your work and for your practices, and to receive feedback about what you will see. So to kick off with the first tool, I'll hand over to Vincent. Vincent will introduce the Open Science Indicator Handbook, so what it is, what it matters, and how it can support impact monitoring across different domains. Vincent, to you.
I should still switch it on? Yes. Now is it working? Yeah. So good afternoon, and thank you for being here. I'll present our PathOS indicator, Open Science Impact Indicator Handbook. Let me also see if this works. I should point it somewhere, and then it should move to the next slide. Yeah, okay. Great. So we decided to make this Open Science Impact Indicator Handbook available as a website rather than as a traditional, let's say, printed version. And this, in a sense, also follows our recommendations to keep indicators also up to date and revise them. So this is something of a continuous work in progress, we could say. The open science monitoring type of activities and different types of indicators are all very actively being developed. And so if we would have produced one single PDF, it would have been buried in a year and nobody would look at it ever again, or at least that was our worry. So we made it available as a website. So it's available on the address that you see on the top left on the screen here, handbook.pathosproject.eu. And I'm going to introduce and tell you a little bit more about the thinking behind it and how we've structured it and the motivations for structuring it like that. So here's the typical linear, I should directly say, type of view that we see here from resources, activities to outputs, outcomes, and impacts, acknowledging directly that we have like the more complicated feedback loops and whatnot. Our aim in the project, and also with the Open Science Indicator Handbook, is to cover the whole spectrum here. And that is obviously a lot. And so that's why I just wanted to include this picture to say we're trying to cover the entire landscape. Louder, I hear. Okay. So this is how we structured the handbook. So here are the different sections where we have an introduction to causality, and I'll say a little bit more about that soon. Then we have a section on open science, where it covers a variety of aspects around open science, including also outputs, but also a number of other aspects. In terms of impact, we're looking, again, to cover things quite broadly, as we have a section on academic impacts, on societal impacts, and on economic impact. And finally, we have one specific section devoted to reproducibility. The first aspect on causality is important in the handbook because we've structured the handbook in a particular way. And the reason for doing this is that we want to make clear that this causality is important when trying to study the impact of open science. And here there's two different things that I would like to call your attention to. It's the impact of open science on the one hand, and the effects of openness on impact earlier. Tony already mentioned counterfactuals and causality questions, and this directly speaks to that. One example is, for instance, we can have an open science software tool. We've developed it as a researcher. We make it openly available. And then we see, let's say, 100,000 users using it. Great, that's impact of open science in a sense, right? There's lots of people using our tool. The question, however, is what would have happened if we started a startup, if we commercialized our tool and made it available in a commercial way, closed? No open license, but closed. Would it have also gotten 100,000 users? Would it have gotten less than these 100,000? Would it have gotten more, right? And so these are two different views. The one of the impact of open science, it has 100,000 users, great. The other one, how was it changed or how is it affected by the fact that it's made openly available? So this is important to keep in mind when thinking about the indicators that we provide in the handbook. So ideally, we would like to focus on the type of impact that is realized due to specific open science practices or open science policies or particular types of outputs or all of these types of things. But many of these things are combinatorial in trying to make sense of. And so we have, if we look here at the different rows, we see open access, open data, open code, and all of these can have different potential impact in all of these different things that we're interested in. So citation impact, collaboration, reproducibility, public engagement, etc., etc., etc. All of these things are very tricky to make stick in terms of a causal argument, right? So we can't cover all of these types of combinations of how various aspects of open science impact all of these various aspects of academic, economic, and societal impact and reproducibility. So we don't include any indicators for causal effect on impact overall. We include a couple of examples of how this can be worked out, and we include an introduction to causality for this purpose. The interpretation of these indicators, still, even if you're not thinking about causal questions specifically, how does the impact change due to the openness, they still require causal thinking. And I'm going to show a quick example to confuse you about it. And hopefully confuse you enough so that you will start looking at the actual handbook in order to make sense of it again. So this is one simulation. So we just made stuff up here, so to speak, just to make that absolutely clear. We have here a perfect indicator for reproducibility, which is obviously in reality very tricky to measure, where we have a clear causal effect of open data on reproducibility. So publications or research projects that are sharing their data, so they make their data openly available, have a higher reproducibility here than publications that do not make their data openly available. So that's great, right? So we see open data helps reproducibility. Okay, perfect. Then let's start mandating it in a particular journal. And let's say we keep an eye on it. So we start monitoring publications. And then we see that reproducibility is here 0.55, whatever that may mean, right? So that's a bit difficult to interpret and difficult to make sense of. So how do we make sense of it? Well, challenging. But maybe we can compare it to like a before and after period. So maybe we can see what was the reproducibility before we started introducing this mandate and what does the reproducibility look like after we started including this mandate. And what you now see is that the reproducibility actually goes down, even though that we know also within this simulation, we simulate it so we know what's happening, the actual causal effect is positive. So you might think, okay, well, we're looking at the wrong thing. We shouldn't compare before and after mandate. We should start looking at actually what is being done in terms of publications in those journals with those open data mandates. And also there, again, you see publications that do share open data have a lower reproducibility than those that do not have open data. And this is a bit of a conundrum. We know from the first view that there is a causal effect. Yes, it's a positive causal effect. Yet when we look just at these indicators, it seems to be negative. And that's the point I want to get across here, that in interpreting these types of indicators and in comparing them across different settings, it's easy to make interpretive mistakes if you don't get that causal thinking right. And so in this case, in particular, it seems suggestive of that there is a negative effect of openness on reproducibility, while in reality it's actually positive. If you don't understand this, perfect, fine. Thank you for, that offers you the opportunity to actually look at this in more detail in the handbook. So there it's explained in more detail and trying to also solve this paradox to some extent. So we have these different sections, and I'm just going to go through a couple of these sections to highlight what we've included and also what we've not included. So in open science, I've grouped them here on the slides to make it a little bit more easy to present. So we have things revolving around resources and activities, things revolving around a couple of indicators around different practices, such as peer review, pre-registration, etc., and a number of things around outputs. Some of these are quite easy to track more quantitatively, right? So that, for instance, goes quite clearly for publications, which we're quite good at tracking quantitatively. Other things revolving around policies and mandates are quite challenging to track quantitatively and will require more qualitative types of indicators. And so this is not meant as a purely quantitative type of handbook, but rather to cover both quantitative and qualitative type of approaches. Moreover, some of them are well developed. Again, publications and open access we can measure fairly well. Other things are much less well developed. And we still include them, not because they're so well developed, but because we want to point out this is what is currently possible. And so that also offers directly, hopefully, input for trying to improve some of these indicators, which we do think are important. So this is for open science. For academic impact, we have a couple of things revolving around publishing and around publications, and one aspect on data and on another on software, which again includes also traditional things like citations, but also somewhat different approaches focusing more on readership, but also collaboration, aspects of diversity, interdisciplinarity or novelty, which are actually quite tricky to measure, as is our issues of quality, which already came up in the sessions in the morning. Use of data and use of software and research is still actively being developed. And so this is one of those areas where presumably the handbook would need to be updated in, well, maybe a couple of months' time, maybe a year's time, but it should be kept up to date for that purpose. So for societal impact, we look at uptake of science in a couple of different areas. And so these are, in particular, policy, education, patient groups, medical practice, and legal sector. These are a couple of specific sectors for which we think we have some ways of trying to track and trace potential use of science. For instance, through medical guidelines, through particular use in syllabi, etc., or in policy, the same thing. We included one more broader indicator here on societal issues, which is more a sort of a process guideline of how to try to track these issues. Because that's one of the problems with societal impact. We are obviously not experts, and it's not even possible, I guess, to create such a type of a handbook of all societal impacts that can be realized, right? So I have a long list, well, not a long, this is relatively short, but you can, you can make it very long, in all of the different things that we don't cover. And so these are issues like welfare, well-being, inequality, sustainability, climate change, energy, etc., that we are not particularly experts on measuring this in society, right? So it's, we would need other people in try to understand that better. The other aspect is that we decided to limit it to things that we are hopeful of trying to track still some elements of science. And this is not in order to say that these other aspects aren't relevant, but this is a way to try to scope, limit the scope still somewhat in this handbook. And so that's the reason why these broader issues, which are very relevant, are not included. We did have one aspect here on scientific literacy, but that's more or less it. For economic impact, well, we'll hear more in the next presentation also on the cost-benefit analysis on this, because we have aspects that relate to innovation and costs and benefits. For the reproducibility, So that's a specific section. Part of it is, again, also using citations and reuse with the idea of if something is more often being reused, then that might be an indicator that that particular software or that particular data set was at least useful to many other researchers, presumably also being a sign of, or at least that is the idea behind it, of it being more robust in a sense. The consistency is looking at particularly some numbers and statistics that are being reported to see if they are consistent with each other, t-statistics, p-values, these types of things, or whether there's any errors there. Finally, the pre-registration here is already covered under Open Science. So this concludes my overview of the Open Science Impact Indicator Handbook. As I've said, it's a website, it's not a book in that sense. So the the URL is here on the screen, handbook.pathos.project.eu. It has a associated GitHub repository. If you have any suggestions, any typos, any errors, any ideas for new indicators that should be included that are missing here, please do reach out to us through the GitHub repository, or there's also another feedback form in general, which you're also welcome to fill out. And happy now to take any questions or comments. Thank you.
Thank you, Vincent, especially for being so timely. I like, in particular, the point on causality that we will see is also crucial in the cost-benefit analysis that we try to address with a counterfactual problem. So if now we have some minutes to take questions. So are there any questions from, so here first and then there. Thank you.
Thank you. I'm Junji from University of Bath in England. My question is about the data source of these indicators. So, for example, one indicator can have different values depending on the data sources, right, like citations. So do you advise on or do you have a preference on the data sources of the indicators? Thank you.
Let me see if I'm close enough. Thank you for the question. So yes, there's indeed, for a number of indicators, there's multiple data sources available. So that's a luxurious position, so to speak. In a number of other indicators, there's unfortunately no data sources available. We typically try to include multiple data sources if that's possible. With a preference for open data sources if possible. And so that's not always possible. We do try to provide some insight into what data sources could be used, and including pointers to the data sources themselves. And so not only including one particular data source. Thank you.
Evgeny Bobrov from the BIH Quest Center in Berlin, in Germany. So I think my question could have probably also been in another panel because it applies more broadly to the PathOS approach, but I think it fits also well here. So I wonder what your opinion is in the regard. I'm still struggling to see the distinction, or I wonder why you chose the terms societal impact and economic impact. Because in my understanding, economic impact is a sub-part of societal impact, and everything is societal impact. So, and also from the examples that you gave, patient impact, for example, of course, if a pharma company develops something, that's the field I'm coming from, that would be an example of patient impact and economic impact. So, in the end, I am not saying it's not useful to define these two fields, but I wonder about the terminology, so maybe you could comment on that.
Yes, thank you. So I think it's useful to have this type of distinction in order to sort of structure the handbook. Because they do have different uses, or well, they do cover different aspects. I think of potential impact. I agree that you could view it differently, of course. So it's not an exclusive way of portraying it. But I do think it's useful to make this distinction in order to structure this. I'm not sure, looking at my colleague Silvia here, who's leading the CBA, also from the economic impact, if she has something to add.
We have discussed terminology issues many times in the past 3 years during the PathOS project. And of course, we also said that I mean, there is not a clear-cut distinction among the three, and among societal and economic, of course, there's overlap. I'm used to talk about socio-economic impact assessment, for example, where societal and economic aspects are intertwined. In this case, we wanted to distinguish under the economic everything that goes in the line of the innovation and economic growth type of aspects. In the societal, everything which instead goes more into widening participation, citizen science, inclusion, equity. So this was the distinction that we made. But I agree that, of course, in some cases things are blurred, and also with the academic impact, you can have economic impact in the academic sector, in the academia sphere. So there as well, that can be some, yes, some combinations. Other questions? Perhaps I can have a question to Vincent. The handbook looks very comprehensive and extensive. I wonder what is missing. Is there something missing in your opinion, or where can be the direction of, I don't know, expansion, evolution, upgrading?
Yeah, thanks. I'm actually, this is also a question to all of you. What you think is missing, I guess, more so than me even. If you have anything that you think is missing and would need inclusion, please do reach out. So one thing that at least I realized when working on another project is that things that are missing here is, for instance, more trust in science. So that came up in another project. And so that is one aspect for which open science could also play, well, perhaps an ambivalent role, perhaps could increase it, perhaps there are some other more detrimental effects it could play. So not sure how it will play out, but at least that aspect of trust in science is one thing that I was particularly thinking would be of interest to include. Again, that's something that we cannot measure typically quantitatively using an existing data source. So again, it would be need to be gathered in other ways. Obviously, there are regularly types of surveys being sent around addressing things like trust in science. So from that perspective, there is something to work with and something to provide. But that's one aspect that I've been thinking in hindsight, like that's something that I'm missing, at least when taking a look this morning. But probably you have also other ideas. Thanks.
Ismail Raffles, Leiden University. One of the comments by Tony was the focus on uptake versus the focus on outcomes in terms of impact. So in terms of this discussion of to which extent is the supply side versus the demand side or use side, what type of balance do you see in the impacts you have generated? I think in some of it, I see, like in societal impact, I see a lot of uptake by policymakers, uptake by patient groups, but this seems to be mainly based on products.
Yeah, so that is indeed one limitation. Or did you want to add still something? No. So this is indeed one of the limitations also that we explicitly took with the societal impact, exactly things that we can still trace. Because there's, as I said, there's tons of things in societal impacts that we cannot trace anything around science. Or at least makes it much more difficult to trace anything about science, and it was a way to sort of delineate what we would and what we not include in the handbook itself. I do think that there is a difference, and so this is also again confusing terminology. That, like Silvia said, we had long discussions around exactly what is the different type of terminology. So Tony mentioned uptake, for instance, in the case of open science or open access mandates, and to what extent this are things actually being published open access, right? So that's still something different from are these publications mentioned in other contexts revolving around policy, or so that's a different type of uptake again than the uptake there. And so we have this problem that in different contexts, outputs, outcomes, impacts can be conceived differently. especially if you start with open access mandates, which is, let's say, really early in this whole chain, then you might conceive of something like this particular open science policy that's led to the building of an open data infrastructure, led to sharing of data that ultimately led to a higher scientific literacy. And so there it could potentially be conceived of as impact. If you think of it, that we have the type of publication that we're particularly interested in, and then this might be more close to an outcome, let's say, perhaps an even long-term outcome, but that depends a little bit. You want to follow up, I see?
Yes, quick follow-up. So I think the key difference to me is the indicators which are based on what the science system provides, so publications that are cited by patient groups, right? But you're still using the publications, right? Versus the indicators which are based on what the users, the beneficiaries, produce or act upon. So in terms of societal impact of patients, I see much more the indicator being on what are patient groups doing in terms of participation in collaborations, rather than what they do in relation to the publications. Right? It's the active working of the patients rather than what the patients are dropped from the science system. And I think that's a discussion that's really worth having, particularly in so when we talk more in terms of participation in broader context. And I'm thinking lots of agriculture, health, in many places of the planet where some of the beneficiaries might not relate directly with science.
So perhaps two aspects related to this. So the first is that we do try to cover some of this in the issue on, or the issue on the indicator on societal issues, which does look at broader, how do we get from societal issues to trying to see where is science used in societal issues. The other is, that's not necessarily directly related to the PathOS project, but I think that one aspect that is useful for studying these types of, let's say, the relationship between science and society is to start indeed looking at, like, what I'm trying to call from the outside in. So we're used to looking at from the inside out. So where is science, what is science doing, and how is it being used by others? And I think we should more, and that aligns with what you're saying now, start looking from the outside in, trying to see where actually particular societal issues occur, where particular patient groups are being active, and how they actually are involved in science or trying to benefit from science, or actually trying to provide input or steering to science. And that is, I think, an approach that is less often taken. And so looking at it from the outside in, I think would be useful there indeed. So I agree, yeah.
Hello. Okay, you can hear me. Isabel Dorsch, my name. Thank you very much for the presentation. I think it's really nice that it is an online format, that it is a website, so it makes it really accessible for everyone, I think. And based on this, I have a question more out of curiosity. How do you sustain the long-term maintenance of the projects, also in terms of updating and hosting? Will it be institutional-based at some point when it's started within the funded project, or how is the perspective of it?
Excellent question, and a challenge indeed. And so that's perhaps also something that goes back to funding of open science and funding activities where they should be aimed. This is something that I think is even more problematic for software, which again also requires maintenance and upkeep. So this is something that we are still working on, that we don't have anything to say on now, but it is on our radar. OpenAir has volunteered at least to keep the website up and running, also after the project is finished, so that's at least one thing. But for having a long-term maintenance, we're still discussing that. But it is on our radar, so yes, but it's an excellent point.
Perhaps we can see whether there are questions or comments from people online. So I ask Claudia, who is the moderator of the online people, to unmute and tell us whether there are some questions or comments.
Yes, thank you, Silvia. So I also welcome the online participants and invite them to post any questions or comments using the QA feature. I will make sure to raise them later in the session. Also, there are no questions yet, but I can read a comment from Mr. Babini, who says, as you've mentioned in your presentation, the need to have societal impact of open science outside academia, it's important for participative open social science research. So I guess this is the only question we have so far, the only comment we have so far.
Okay, thanks a lot, Claudia. We welcome all the online participants to use the Q&A chat to drop questions or comment. And I think we can go ahead now with the following speaker. Vincent was very clear in stressing the need to have an interpretative model, because indicators per se can be without meaning if you do not have a model in your mind that helps you understanding what is behind the number of or the indicator. So we will see how this problem is addressed in the next presentation by Jessica. She will present the framework of cost-benefit analysis that we developed for the open science. Floor is yours.
Thank you, Silvia. Good afternoon to everybody. My name is Jessica Catalano. I'm an economist at CSIL and specialized in socioeconomic impact assessment and cost-benefit analysis. So my presentation today will cover another output of a PathOS project. So the cost-benefit analysis framework we have specifically tailored for assessing open science practice. So with the PathOS project, we have tried to understand and described what are the impact pathway of open science. So basically, how resource invested in open science translates in activities, outcomes, output, outcomes, and then impact. And Vincent before provided you an overview of the handbook that we have developed in order to provide a set of indicators to measure impact on economy, academia, and society. So where the CBA fit in this overall framework? So the CBA provides an assessment framework to support investment in open science, decision in investing in open science. And it shows how some selected indicator can be used to take this decision. It allows to compare cost and benefit of an investment in open science and provide a quantification in monetary terms of this effect. So, but for those who have never heard about cost-benefit analysis, let me briefly remind what it is. So it is an analytical tool that is used to support the decision-making process. And as I said before, it allows us to compare what are the costs and the benefit of an investment. And the desirability of an investment is achieved when the benefit outweighs cost. So it is a very systematic approach which follows clear rules for its application. So I will not go into details of the methodology, but just to let you know that the most important things of this methodology is that when we consider the cost and the benefit of intervention, we do it by comparing with the scenario without this intervention. So this methodology allows to get what is the net effect brought about by the intervention. And the benefit and cost are evaluated over a certain time horizon. So by looking to the time horizons where this cost and benefit materialize. And the most important, the cost and benefit analysis focus on those this methodology focuses on those effects which can be directly attributed to the intervention we are evaluating. So in the framework of PathOS project, with the cost-benefit analysis, we tried to measure those effects which can be directly linked to the open science practice we are evaluating. So it is a well-established methodology, and its usefulness and reliability has been recognized by several European institutions which have adopted this tool for decision-making process, but also by international organizations and national agencies. So how to put in practice this methodology? So our roadmap to apply this methodology suggests to keep in mind some key steps. What we have been learning during this 3 years project is that open science practice are collaborative resources. So there are a number of stakeholders involved in providing these resources, and you may have a database which is open and is maybe connected to other external resources. We will see the example of Uniprot during this presentation. So basically, the first step is to define which are the boundaries of the open science resources we are assessing. What is the scope of our analysis? Then once we have identified which are these boundaries, we have to understand what is the counterfactual scenario. This is a jargon that in cost-benefit analysis means that we need to think what would happen without these open science resources. The content of the database would be provided in a closed scenario, would it be provided by other open database, but in a fragmented way? So we have to think about this and address this question. Then we have to map who are the stakeholders affected by these open science resources, both on cost side and on benefit side. On cost side, we have to think who are the people who are financing these resources, who manage these resources. On the benefit side, we have to think who are the user of these resources, who can benefit from it. And once we have identified these stakeholders, we have to better understand which are the costs that they have for these resources, they put in these resources, and then which are the benefits. And try to understand for each of them who is going to have costs and who is going to take advantage for these resources. And then we have to start collecting data, and this can be done in several ways. I will mention some methods that we have used for the case studies we have developed in the framework of PathOS project. And once we have collected data on cost and benefit, we basically compare this cost and benefit and calculate the economic performance indicators, which in cost-benefit analysis is a number which gives you a measurement of how much, to what extent benefit outweigh cost. In this called benefit cost ratio. So during the PathOS project, we have tried to identify which are the typical costs and the typical benefit associated to open science. And building on previous literature and what has already been done before, we tried to understand and to better describe which kind of cost we can associate it with the open science. And here you have an overview, and you can see that the costs of open science are both for the provider of the open science, so basically the organization who set up or invest in the open science and manage the open science resources, and both for users which contribute to the open science. Let me give you the example of Uniprot that has been used as a case study for this project. Uniprot is a database, an open free database providing information on protein. the costs are borne both for the organization, the UniProt consortiums who manage these resources, but also for the users who provide updates to these resources and data to this database. And then on the benefit side, we identified 4 different types of benefit. So the extent to which this benefit materializes also depends on the nature of the open science resources. And here, maybe you have cost savings for the users. So the user has not to pay to access these resources. The users save time in accessing these resources and also save time in doing its work because he has not to recreate this data or the information provided by the open resources. And also the fact that these resources provide data that are integrated in an open, free platform, they also save storage costs because they don't have to basically collect data and put it on a closed system and pay for this system. So we basically distinguish these costs in 4 types. As I said before, once you have identified the cost and benefit that are relevant for the open resource we are assessing, it is important to start collecting data. On cost side, the main source is the provider, is the organization who manage these resources. So they should keep track of the costs, of the personnel costs they need to employ to maintain this resource operating. On the benefit side, the most common methodologies that we can use are survey to users, interviews, focus groups, and in order to get what is the time that these users saves for in accessing these resources as compared to an alternative scenario. And then there are different methodologies which helps us to translate this data in monetary value. And these methodologies are well used in the literature and are very well established methodology. So we tested this methodology on 2 different open science resources. I mentioned it before, UniProt, and we find typical cost of UniProt and typical cost and benefit here. And what we found here was that the main benefit on UniProt is basically the saving labor costs. So users save a lot of time in doing their research thanks to the fact that they access integrated information. And also on the cost side here, we try to understand what are the costs of the supported by the provider, both to set up and maintain the resources, and also the cost supported by the users to update these resources. And we did the same recap, and as you can see, so the type of cost and the benefit are slightly different because it depends also on the objective pursued by the open science resources and on the nature of these resources. In the case of recap, Louis will tell you more. We identified, for instance, on the cost side, cost both for the provider at the central level, but also for the institution participating in these resources. So I will not spend so much time on this. So what we learned from this exercise? We can confirm that the cost-benefit analysis is a structural tool that can support decision-making process, so can provide evidence on whether it is worth or not to invest in open science. Of course, it requires reliable data, reliable monitoring data, so we struggle also to find some data in our assessment, and Louis will tell also more about the recap case study. And what we learned is also that once approaching and when applying this methodology to open science, we should keep in mind that these are collaborative resources. So taking a multi-stakeholder approach. So try to understand who are all the stakeholders involved in open science, and also try to understand if these open science resources already built or not on existing database, on existing previous resources. This is really important to define the scope of our analysis. And as I said before, it is really important to answer the question, what happens if the open source did not exist? So this allows us to get the true value of these resources. But most important, it is also useful to have a good metric of the users, of the usage of these resources. What we struggled indeed was to find data on the users of these resources. The most common, what makes open science easy and is that they are free accessible, but on the other hand, it is difficult to track the usage of these resources. And many times, the data that we found are about the web traffic. So the users that basically access to these resources are tracked through the IP address, but this can be a misleading measure of the open of its use. So, and specific techniques should be adopted and applied in order to transform this data in the real use of the resources. So, to take the real number of uses, and this is what we did in our case study. So the first step in our, the lesson that we mostly got from this project is to start adopting the CBA mindset. So from the provider side, start collecting data that can be then used by expertise and apply this methodology and provide the real value of these resources. So we tested this methodology on 2 different open science practices, and here you will find the result of our assessment. So a methodological note providing the description of the framework, and then each case study is providing how we apply these methods and what are also the challenges and the solution that we found to address these challenges and applying this methodology. Now, it was supposed to have a
Open
video.
science has the potential to accelerate research. But how can we measure its impact in a rigorous, systematic way? With PathOS, we designed a cost-benefit analysis framework to understand the true value of open science, assessing its costs and benefits and comparing them with a scenario where open science doesn't exist. We applied this framework to measure the value of Uniport. A global open science infrastructure integrates 4 core databases providing standardized, curated protein data, continuously updated, community-enhanced, and cross-reference for research worldwide. Uniport supports life science researchers across academia and industry, with most users based in North America, Europe, and Asia. It is widely used in bioinformatics, biomedical technology, and pharma. The analysis estimated both the costs and benefits associated with Uniport. On the cost side, expenses borne by both the provider and users were considered. On the benefit side, users experienced several efficiency gains. Uniport helps avoid redundant work, saves time in accessing data, conducts research and reduces data creation costs. The estimated annual cost of Uniport is approximately €14.6 million, with over 70% of this budget dedicated to expert human curation. Researchers save up to 300 hours per year, translating into an estimated value of €373 to €565 million annually. Overall, the benefits of Uniport far exceed its costs. Our analysis went beyond measuring costs and benefits, capturing longer-term effects such as knowledge creation. Uniport is mentioned in over 15,000 scientific papers, making it a key driver of research across disciplines. With over 183,000 patent publications mentioning Uniport, it fuels innovation, from drug development to diagnostics, and is trusted by global R&D leaders. By making core data freely available, Uniport accelerates the development of new products and technologies, driving economic growth from the lab to the market. Based on our user survey, 74% of respondents said they would lose access to the same quality data without Uniport. Many couldn't recreate it, publish as quickly, or collaborate as effectively. You can access all our findings in the full case study report and explore additional resources, all open access and developed through the Horizon Europe PathOS project at pathos-project.eu.
Okay, so these were the findings of our case study on Uniport. And now I leave the floor to Louis Colnot, who will present you the case study on recap.
Sounds like a bit of a magic because the video was not working before, so seems like we evoked some. If it appeared a bit abstract, now you will see in more details what we did to apply the methodology to another specific case. Louis?
Yes, exactly. So thank you very much, Jessica, for introducing the framework, and now we'll try to guide you through how it can be implemented in practice. Basically, it was quite an interesting experience because in the context of open science, CBA was not really developed at this stage. So we learned things, we revised the framework based on the two case studies. So I will not be able to walk you through all the details, but it should basically give you some interest in the main findings and hopefully give you the willingness to read the full report later. So first, I need to basically give you some basic information on what RCAP is, which is the subject of the case study. So Eloy basically introduced you some key elements this morning, but basically the idea is to get you on the same page. RCAP is a network of institutional repositories, which is based in Portugal. And all these repositories are aggregated and available through a single portal in order to search the content. On the right side of the slide, you can see the portal at the top and an example of repository, which is aggregated at the bottom, which is the Unimio one. So this system has key features, including a complex governance structure, because there is the RCAP central system, which actually manage the infrastructure. And then there are all the participating institutions in Portugal, including universities, hospitals, and other types of stakeholders. It means that there are different types of repositories, which are part of RCAP. Some are managed directly by the institutions and aggregated later on RCAP, but some are actually hosted by RCAP centrally, free of charge. So it's a big benefit for some institution. And it enables the system to actually pool resources, because instead of having several institutions having complete teams of people managing the repository, you can have some common vision and people in charge of these issues. Regarding the scope of RCAP, so we are talking about institutional repositories for all fields of science, and we are mostly focused on Portugal and Portuguese-speaking countries and users. So, of course, like Rome, it was not built in a day. You can see here on the left side the growth of the number of institutions taking part in RCAP over time. You can see it was launched in 2008, and it grew substantially over time. You can see the different types of repositories. The local ones are the ones that actually manage themselves, their repositories, and then they're aggregated on RCAP. And the two other types are actually institutions that benefit from this hosting service by RCAP. And on the right side of the slide, you can see the number of visitors to RCAP, so to the RCAP portal. And you can see the same type of growth over time. And basically, in the recent year, we have about 150,000 users on a yearly basis. So just to give you some basic information on the CBA, the process of actually implementing in practice the framework presented by Jessica. So the first key decisions were to actually set the scene, the scope of the CBA, to see what is covered, what is not covered in analysis. So we decided to focus on the document repositories, because there are other types of services provided by RCAP, and on the portal, which form a coherent unit of analysis. We've analyzed the information at the level of the central RCAP level, but also in all the different institutions that take part in the system. And we've covered 20 years of RCAP, which is a typical length for this type of IT project, let's say. Then there is the key element of the counterfactual. As Jessica mentioned, the counterfactual is imagining what would have happened in the case that RCAP would not have existed. It was challenging because stakeholders may not have a full consensus on what would have happened with RCAP. but we decided to take as a baseline the fact that we would have seen without CAP a development of institutional repositories in Portugal, but of course we would lack all this pooling of resources, this common portal, and so on and so forth. We've also done a series of data collection and evaluation activities. So we've done primary data collection. We've done a survey to users of CAP, which was not done before. So to understand who the users are and how they're using the system. We've done qualitative data collection, including a series of interviews, focus group, and so on and so forth. And we also reviewed quantitative data, especially on budget and visits. And we've also relied on secondary data sources, especially regarding the cost, but also some other surveys on some particular aspect, not on CAP users only, but mainly on the institutional side, let's say. With this data in hand, we were able to do the different steps of the analysis, so structuring the CBA, building the assumptions of the model, modeling the actual number, and then we've run tests and the results, let's say. So this is this slide summarizing the type of costs and benefits we've included in the model in the end. So it was already shown by Jessica, but I will give you more details. So in terms of costs, we've covered the provider costs, including at the level of RCAP, so centrally, but also in the different institutions. And we've covered the setup costs, so the cost necessary to actually launch a system. So for instance, equipment costs in terms of server, software costs, these kind of things. And also the operational costs, which are the costs needed to actually operate this system. So it includes things like salaries and so on and so forth, electricity, and these kind of things. We've also covered the user costs, which are the costs borne by users, which can be researchers, librarians, administrative staff, in order to actually make the system work. So here we've explored different types of costs, training costs, deposit costs, the fact that, of course, people have to actually spend time to put their documents on the different repositories. And we've also explored access costs, meaning the time people spend to actually retrieve the documents on the different repositories. This we were able to partially document it. We were able to document it in the case of the real world scenario, but in the case of the counterfactual, we could not get very consistent results, so we decided not to cover it inside the full CBA. So it means that basically we are proposing a conservative approach. In reality, the benefits of CAP would probably be higher because we expect some savings linked to the fact that people spend less time in actually retrieving the documents. And on the benefit side, we mainly included labor cost saving due to the pooling of resources, the fact that you have one team at the central level actually managing different repositories, and data storage costs for the same underlying reason. So here are some results of our modeling. Here you can see on this slide the total cost of RCAP. So it is in the scenario with RCAP, so the scenario that happened in real life. You can see that over the total period on consideration, we have 41 million euro of costs. These costs, obviously, they rise over time because at the beginning there were few repositories, but with the increase in the number of institutions participating, you have this process of increase. And in the final years, so we have reached a plateau in terms of actual use and development of the system. We see that we have about 2.8 million of cost on a yearly basis. And you can see the different type of cost. Clearly, the operational cost of providers, so meaning the institution and CAP at the central level, dominate this picture. Then we take a look at the benefits. So here we take a look at the labor cost saving and the data storage cost saving allowed by RCAP. Over the total period, we have saving benefits about 6 million, sorry. And in recent year, it's a little bit less than €500,000. Of these total benefits, we can see that the labor cost savings, the fact that we have common team managing these repositories actually dominate. And as I've mentioned, these benefits do not include the fact that people may spend less time accessing resources. So this is a conservative estimate of the benefits. So here you have the net picture. So here we are comparing the scenario without recap in our counterfactual with a scenario with recap. You can see the cost. At the beginning, you have only cost because it takes time to actually implement the system, get the server running, and so on and so forth. And then from 2008, where we have the launch of the system open to the public, you can see the first benefits. You can see at the beginning that the net benefits, so the difference between the two curves, are actually a negative, but that it gets positive after a few years. And in the most recent year, we see a clear positive benefit in net terms. So to get you a summary of the results, we can see that overall, when considering the entire period, we have benefits that are about 32% higher than the cost. We see benefits of about 4.8 million, so labor cost saving, data storage cost saving. And we can see cost of about 3.6 million. So in terms of difference with the scenario without recap. So in terms of how we interpret basically this result, we see that cost savings can be actually a significant part of the benefit of open science project. Here we've looked at document repository. Of course, the dominant benefit would depend a lot on the type of open science project we're considering. It's important to take a look at the benefit not only at the level of end users, like researchers, but also to consider the benefits that are more linked to the institutional dimension, as shown here. We've seen that integrating some benefits in the analysis can yield some significant challenges. Here I mentioned the fact that access cost savings were difficult to actually document in the case of the counterfactual scenario. Basically, we've also looked at benefits beyond CBA. Here in the context of recap, the main benefits are related to the academic sector, but there are also some benefits beyond that, social and economic one, but they are likely smaller and quite challenging to document, to be honest. Okay, so, and then just to open, let's say, the discussion, I would like to mention a few points about further refinements to the analysis we can do in the future, because as I've mentioned, this CBI framework was not applied in the CBI context before, so we loved things and we know that a lot more is possible. So let me just mention the fact that we could consider alternative counterfactual scenarios, because as I mentioned, people did not necessarily agree on what would have happened with a trap, so this is a way to expand the analysis. It's also possible, at the condition of getting more granular data, to break down the cost and benefit for the different institutions participating, because I've mentioned that there are about more than 100 institutions, so we have to rely on a sample of different ones, of different type, but we could go deeper, let's say. And the last point would be to integrate more fully the other benefits that we could not actually put in the model at this stage. So basically, that's the overview of recap. I hope it was interesting and it gives you the willingness to actually read the full results. And then I think we'll have a discussion together. Thank you.
Okay, thanks a lot, Luis. It's very valuable to see how the framework can be put in practice and which are the potential results and how this can feed into the discussion and the decision making. So I would like to open it up to you and to see whether you have questions, comments. Lena.
Thank you. I have a question to recap because it was very interesting. You gave this curve of the comparing costs and benefits. And obviously at the beginning, you have a very high initial investment cost and the costs are much higher than the benefits. But then towards the end, you have a reduction of the shared costs to benefits. Where can you attribute this?
Yes, thank you very much for your question. Basically, at the beginning, you have all the costs related to the infrastructure, especially at the central level. And it includes preliminary studies, a lot of them. It includes actually the servers and so on and so forth. And it includes getting all the first repositories started. Then over time, you have, let's say, you still have investment costs, but they are spread over time because you need to replace some server over time and so on and so forth. So actually, you're actually diluting this renewal cost over time, and you get this actually quite big reduction in the cost.
Yes, but the problem is that at the end of the period, they are increasing again. That's what
okay, so I didn't catch that. It's because there are actually different waves of repositories. They were not launched all at the same time. And actually, when you're renewing the servers for these repositories, it happens at different time. And since the volume is not the same, you have this ups and down over time.
Sorry, can you project the slide again? Because it was not up and down. It was a clear trend of going up again. You see?
Yeah, so you have this up and down at the end. At the end, we are in downward trend because we are not at the renewal for the late repositories. But then if you would continue, you would see some increase again.
Maybe it would be very useful to decompose then the costs per repository, per
yes,
data.
we have it, of course. I did not show it here, but we do have it, yeah. And as I mentioned, it's really due to the fact that there are different waves of different repositories at different time.
Yes, coming back, I think it was Tony before that made a distinction of like open science for access and for transparency, for participation as different dimensions. I mean, both the process, I mean, for both of the case, the cost-benefit analysis case studies, I think we're mostly looking at access, which is the most evidently quantifiable things. I mean, how do you do it for the other dimensions? I mean, if you're talking about research, I mean, transparency, meaning that we get more research quality, which is very hard to measure because it happens on long term and whatever. Or if you want to have greater participation in which you have to like put price tags and like what that's worth. Can you even try to begin doing it? Or, I mean, does your cost benefit framework actually works for these other dimensions? Or are we just constrained at looking at access because that's what you can get through?
I'm not sure I got your question, but I try to answer. So basically, you are asking that our framework provides a measurement of access cost savings, and if this framework can be applied to measure other dimensions such as collaboration, transparency, and so on. So what I stressed in my introduction is the fact that the key contribution of the cost-benefit analysis in the PathOS project is it provides a measurement and the quantification of the short-term outcome of open science practice, which means that all these effects that can be directly attributed to open access, to open science. So this is a key peculiarity of cost-benefit analysis because this methodology adopts a micro perspective, so and also measure what can be really attributed to the investment. The problem is that, of course, there are effects which goes beyond, and so the collaboration, the quality of data, and so on. But here you have other factors that can contribute to the materialization of this effect. So the cost-benefit analysis can try to explain how this effect can be enabled by provide a first step measurement. Then, as you have seen in the UniProt case study, we have tried to go beyond CBA and try to measure what happens thanks to the fact that these users easily access to these resources. So basically they have greater collaboration, more publication, and so on. So our findings is that this is also something that was mentioned during the morning session, is that combining different techniques and different measurements give you an overall picture of the impact pathway of open science.
Yes, I may complement perhaps, but yes, indeed, the cost-benefit analysis mainly focus on the efficiency types of aspects. So the reduced time to perform research, the avoided costs for storage, for example, of data, and the most immediate that relates to the user. So what happens when an open science practice is developed and maintained, and how this can be observed and measured and translated into a monetary value. And many aspects lend themselves less well for this kind of treatment, actually. We can describe it more qualitative terms, but they cannot be translated immediately into these types of measures. Tony.
I would just say on the participatory aspects, it would be very possible to look at the efficiency and the cost benefit of citizen science, for example, in terms of how to generate data, which otherwise would be very costly to get. And as I understand, I'm not an economist, as you know, but through working with you, there are ways to model other costs in dollar terms. And so if you then think about the value to society of having more educated populaces and how this might lead to science uptake and so I know that we're especially very keen to continue the discussions on how more broadly we might model this towards transparency and participation.
Yes, it's true. One way to measure the benefit of citizen science would be to look at the avoided costs or the fact that thanks to people participating in doing science, like observing things, the research system can save costs. But we didn't find any literature evidence in the literature on this. Perhaps we can take some questions or comments from online participants. Claudia, do you have some questions for us?
Yes, please. I have 3 questions from online participants. The first one, what if a decision needs to be made on an investment in a new open science resource initiative for which you don't have data yet on actual costs and benefits? Can part of the CBA still provide a useful framework there? I'll also read the second 2 and pass you the floor, Silvia. The second one is, can you please briefly explain how the time saved for data storage was calculated? And I think this is for the recap presentation. Then a last question. Can you share how resource intensive the development and application of the CBA framework was in terms of time, funding, and staffing? For example, how expensive was it to collect, clean, and process the data for just one open science intervention? Over to you, Silvia. I also invite other participants to use the Q&A feature again for further questions.
Okay, I will take question number 1 and number 3. So question number 1, the answer is yes, the CBA can be used at any stage of investment decision. So this tool has a well-established and long tradition of application in different sectors, and it has been used to assess the value of an investment ex ante, so before the decision is taken. So in the mid, so when the resource is already operating, as we did in the case of RECAP and UniProt, and also after, so to see what was the effect of the investment. So in this case, ex ante, of course, it is challenging because you don't have historical data. In that case, you should rely on a similar investment, comparative resources, in order to get some assumption on what can be the cost or try to estimate what can be the usage of these resources. So of course it is a forecasting exercise, but what makes this forecasting exercise more robust is the fact that you can complement this cost-benefit analysis with also sensitivity and risk analysis, where you go to test the assumption and see what happens if some range of variables are applied to this assumption. So the question, the answer is definitely yes. You can use this tool also ex ante when the decision and the resource is not in place. The answer to the third question, the third question was about the...
how expensive was in terms of time and resources.
Thank you, Silvia, for reminding me. So, yes, as I said, this was a 3 years project, so we spent almost 1.5 years working closely with the provider of these resources. So it is not only work which is done by the expert, but it should be done in collaborative way with the provider of the resources. So we should make available data. So we basically carried out this work in 1.5 years, and the data collection was extremely intensive because, as you may imagine, so these resources build on existing database and so on, so they had to retrieve historical data, and we had also to launch a survey to users. So I think that to make a reliable and full-fledged CBA, it is essential to have at least 1 hour of work on it. And it is essential to combine the expertise of professionals, but also monitoring data provided by a resource manager.
Yes, and I can take the question on the data storage costs. Basically, to answer the question, you combine multiple sources of evidence. In the case of CAP, we actually have some repositories that do the storage themselves. So we have data from them. There are data actually on CAP published in the literature, especially for Uni-Minio. So there are some baseline data to get the storage cost of a typical repository. Then we've reviewed data from the secondary sources, and we've carried out a series of interviews with repository managers, which have some idea of the potential costs of such storage. So it enables to compare it then to the actual cost of CAP at the central level.
Okay, so since we mentioned the collaboration, the strict collaboration of our team at CSIL with the people, the representatives of the two open science practice, I would like to bring in the two representatives of those practices into the discussion to reflect with them and have a sort of a bit of a meta-reflection. So we can think about a cost-benefit analysis of the cost-benefit analysis, if you will. So the pros and cons of carrying out this kind of exercise. It was a long journey and exciting, at least from our side. It would be nice to hear from you, from both of you, Despina and Antonia. From your perspective, what would have been the most significant benefits for you of conducting this cost-benefit analysis, both internally, I imagine for internal management or strategic planning, and externally, so in the dialogue with your stakeholders. Perhaps, Despina, you want to start?
Yes, thank you. It has been a very exciting journey as well and very educative. We are in life sciences, so we've never done this type of research before. As I mentioned in the previous panel, we've done impact, but going as deep as economics, it was out of our depth, definitely. So it was great to collaborate with the experts on this. As we mentioned, UniProt is a very fundamental protein database for life sciences. So we know, the scientists in life sciences, they know how important this resource is. In 2021, also AlphaFold came out. The models were based on this big open protein data. So it was great to see how you can affect a novel technology. But of course, the funders, they're not life scientists, they're not even scientists, so we always struggle in the communication, despite that there are evidences to prove our impact and the importance. So this type of work is what actually give us the right tools to talk to them and show with proof, tangible proof, that the taxpayers' money investment, it is worth it to go in this direction. So yeah, I would say the most important, it hasn't been so much internally because scientists know very well, but externally and more this communication with the funders. And the other part that I think we've never also asked ourselves, but we asked it through the cost-benefit analysis, was this counterfactual side, the what if. This, I think we've never collected data on this, and it was quite interesting to see how much the academics, they really believe that, well, if it wasn't that, it would have been another one. So they seem to not worry that things can be open, but of course, then it comes the question of on the quality. UniProt is very interlinked, as I was saying before, very high level interlinked and interoperable data. So the quality, of course, was not what they could answer for sure that another open access repository will have. And also interestingly, the industry respondents answer quite similarly. Nevertheless, still the smaller companies, they seem to worry that maybe closed things will exist for them. So yeah, that was a very interesting finding.
Hi, thank you. So for us, this was also a great experience, so a great journey, getting into the CBA mindset, as Jessica was saying. So and it was really rewarding to see that RCAP is really embedded in the institutions, in the people. So people had a really hard time imagining RCAP not existing, not being there. So, and this was also very rewarding. It also gave us a very clear measure of the return on investment. So for our funder, that it's really worthwhile to have RCAP around, and for the researchers, because there are not a lot of initiatives around getting people unified as a community, as RCAP has been doing for a long time. And also, of course, it gives a lot of support for the smaller institutions, because there is this hosting service that RCAP is offering, and so smaller institutions that otherwise would have a hard time setting up a repository and maintaining it, they can benefit from this. And so this, it's a more equitable world for people in Portugal, because everybody can participate and have the publications open access with a little effort. Also, the training services, the hosting services, the help desk that RCAP provides is also very valued in our institutions and in the researchers. So it has been really a very good exercise for us.
Okay, but since we know the importance of balancing benefits and costs, we also want to learn about the burden and the cost and the challenges, perhaps, that you faced in trying to perform this exercise. So I wonder whether you had to struggle internally, you had to invest a lot of time, I assume, of you and other people in doing this. But it would also be good to know whether the results, whether the challenges and the burden were also in terms of interpreting and really understand the types of results. So
I can start. Yeah, that was the main challenge, is bringing together people, even if people that they have the same vision and they want the same thing. Still bringing the people together can be challenging because they speak different languages, right? So I will not talk about the time because I think we have been quite time efficient in our approach, like 1 meeting per month with the experts, which I think no one felt it was a burden. Though, as I mentioned, bringing the people together, so bringing the scientists that they do the technical part of the resource, they receive the funding, they do keep some records. Yeah, they do all the science also behind it, sustaining and bringing the community together. And then the economists, of course, that we have in the panel, and then the communication experts, because these conclusions have to be communicated. So the first part of the scientists, they may not keep the perfect records for a study like this because they are not economists and they haven't done a pre-study before, as it was one of the questions. So yeah, probably they were not in the best shape, with limits, as far as I understand the analysis, where then the economist comes in, they have to do the hard maths, they have to drive the conclusions based on what they have, and then the communication experts comes in, they have to communicate the message, the conclusions to the different audiences. So they have been oversimplification sometimes, or making bigger statements than what we were comfortable with. So there is a continuous loop of communication back and forth, which you have to be patient with that because the end product is much better. Everyone contributes in the loop, so there is the benefit also with the struggle.
Yes, for us, so it was a mix because, well, CAP has been around for a long time and it has a very stable structure. So it has an annual budget and all of those financial costs are very well documented. But then from the side of the institutions, it's harder to assess, because it will depend on the institution, it will depend on the size of the library, for example, because most of these curation things are done by the libraries and repository managers. And usually you don't have one repository manager only doing things related to the repository and RCAP, so they do a lot of more things. And so it's difficult to assess the time that people take and the efforts. And also, when thinking of the counterfactual, so people use RCAP for publishing, so what are the costs of not publishing in RCAP? Well, otherwise, other than the diamond open access, then you have the costs of publishing gold open access, and this is not well documented, so we don't have access to what people are paying in all of the Portuguese institutions to pay open access. And so it's hard to have these costs documented and to take them into consideration. So these are things that still need to be taken care of, the APC costs and also the costs that people are paying to subscribe to get access to the resources, because most of the publishers also ask people not to give away these values that they pay. So we need a lot more transparency in these costs that people are paying to publish in order to do an assessment that is more comprehensive. And of course, the human resources costs that I already mentioned with the data curation work. So these were our main struggles. Also, RCAP is very complex. So we have the portal, we have the harvesting, we have many components to RCAP. So we had to choose a small part of RCAP and compare the hosted repositories with the ones that were not hosted. But of course, we could enlarge these analyses later on if we get the if we get the costs for doing so. Yes.
Okay, thanks a lot. I do not have the exact numbers in front of me, but I would say that the cost-benefit analysis of the cost-benefit analysis seems positive. So we are happy about this. Let me say just the last words, perhaps, in saying that part of I mean, cost-benefit analysis is a data-intensive type of exercise. So part of our struggle was also due to the fact that the data were not structured and put in a way that was meant to be used for an impact assessment. So, but if you start since the very beginning with an impact assessment type of mindset, you can be prepared. And you can save time when you decide to perform a systematic assessment, and you can have the data in order, you can save time in doing this kind of exercise. So I think this was all, and in case there are other questions or comments, we can take them over a good coffee. Thanks a lot, everybody.